Good morning, everyone, and thank you for joining the International Bipolar Foundation this morning for our webinar with Dr. William Marchand. Dr. Marchand is a board-certified academic psychiatrist with over 23 years of clinical experience. He is currently a clinical associate professor of psychiatry at the University of Utah School of Medicine. His research interests involve using functional brain imaging to increase our understanding of human neural circuitry, as well as investigate the causes of bipolar disorder and major depression. He is a mindfulness practitioner and teaches mindfulness-based cognitive therapy to individuals with bipolar disorder and other psychiatric conditions. He is the author of Depression and Bipolar Disorder, Your Guide to Recovery. Today, Dr. Marchand will explain the basics of mindfulness and describe how a mindfulness meditation practice can benefit those with bipolar disorder. He will discuss using mindfulness to manage depression, anxiety, and stress, and he will provide a step-by-step guide to developing a mindfulness meditation practice, which includes using a very brief meditation during episodes of high stress and emotional discomfort. Welcome, Dr. Marchand.
Thank you very much. Good morning, everybody. Thanks for joining me for this presentation. Just one second. So the plan for today is that we're going to talk about mindfulness and split it into kind of three parts. The first is, what is mindfulness? Then we're going to talk a little bit about how mindfulness can help with depression, anxiety, and stress. And then we're going to talk about how to get started in a mindfulness practice. So let's start with just talking about what we mean by the term mindfulness. A very simple definition is that it's just keeping our attention focused on the present moment, on right now, on whatever is happening in this moment. And one way to think about mindfulness is to compare it to our normal mode of brain function, which we use the term autopilot for. And autopilot is how our brain typically works. It's our stories, it's multitasking, it's thinking about the past or future, thinking about ourselves or mind wandering. A good example that we can all relate to is driving down the road, going to some destination, and realize that we get there and don't remember anything about how we got there. Happens to all of us, but it's a good example of the mind wandering off on autopilot while we're doing something else. In contrast to autopilot, mindfulness is being aware of right now, of the sensations, thoughts, and emotions that are occurring in this very moment. So again, autopilot is typically thinking about the past or the future. It's reliving or reminiscing or regretting the past, or planning for or worrying about the future. Whereas mindfulness is being fully present with each moment. So mindfulness is a very simple concept. It's not at all complicated, but it's very difficult to do because our minds want to wander. And so, like other things in life, it's a skill that we have to learn. And we'll talk more about how to learn that skill in a few minutes. But first, a few more words about autopilot. It's just the way the mind works for everyone. It's the way my mind works, and it's completely normal. In and of itself, it isn't good or bad, and oftentimes it can be helpful. But frequently it's unhelpful, particularly in regard to depression, anxiety, and stress. So how is autopilot helpful? Well, we can use it for multitasking because we can drive down the road and think about something else. We don't have to think through every step of a task. Many learned behaviors we just simply do without needing to think about, and that's very helpful for us. And particularly because autopilot is focused on the past and the future, it motivates us to think about the past and learn from the past and plan for the future. It's one thing that makes humans unique. So autopilot in and of itself is a good thing. The problem is that it often makes symptoms worse. And mostly that's because of some thinking patterns that we're all very familiar with. Worry, rumination, obsessive thinking. And we all do that. And we'll talk more about how that can cause increased depression, anxiety, or stress. One thing about autopilot is that it's the brain's automatic response to uncomfortable emotions or situations. And the tendency of our mind is that we want to make things better. We want to find a solution. And again, potentially this could be helpful. But oftentimes what happens is we get caught up in spirals of autopilot thinking. We get stuck in our thinking ruts and can't break free. And it becomes very unhelpful, as you'll see. So, if autopilot is working really well, we have stress or we have an unpleasant emotion, our autopilot thinking patterns kick in, and we find a solution to the problem and move on. And certainly that does happen sometimes for us. But as we become mindful and we start watching our thoughts and emotions and noticing how our brain works, we notice more and more that oftentimes that autopilot process actually isn't helpful. Because this is what actually happens many times. And as I observe my own mind, I certainly see that in myself. And I'd invite all of you to observe and see whether it's true for you also. So maybe we are in a stressful situation, something is upsetting for us, or maybe we just start to notice some out-of-the-blue feelings of depression or anxiety. And our autopilot thinking patterns kick in. For example, we might start thinking, oh no, I'm depressed again. How long is it going to last? Last time I was depressed, it lasted for 3 weeks. What should I do? And we notice that one thought leads to another, and it goes around and around in a vicious cycle. So instead of leading to a solution, that kind of thinking often just leads to more autopilot-based thinking. Thoughts going around and around without any solution. So with stress, it's this very simple cycle of stress, autopilot, more autopilot, making the stress worse, going around and around. And I think we can all relate to that. You'll notice that for depression, we have exactly the same illustration. And for anxiety. And that's one of the important take-home points, is that this autopilot process works the same regardless of what the emotion may be or the stress may be. So by learning mindfulness meditation and being able to escape from autopilot thinking, we can manage a variety of symptoms and uncomfortable situations. So let's just take a moment and think about why autopilot doesn't work. One reason is that it doesn't want to accept reality as it is. And again, I would encourage all of us as we practice mindfulness to just notice our own thinking patterns and notice that in many cases, when we're thinking about a situation, we don't really want it to be the way it is. We want things to be different. One of the problems is that reality already exists and is unchangeable. We can certainly change the future, but we can't change right now. And so if we are engaged in thinking about not wanting things to be the way they are, that's autopilot and it isn't helpful. We always have to start from acceptance of reality as it is. This is what we call the mindfulness equation. pain times resistance equals suffering. And this is really a very key concept of mindfulness and a mindfulness practice. And when we talk about suffering, we just use that term to mean unhappiness or discomfort with a situation or emotional pain. But whenever we resist reality, we create more discomfort for ourselves. A few minutes ago, I mentioned the example of feeling depressed and starting autopilot thinking. And a lot of that autopilot thinking might be, wow, I wish I wasn't feeling depressed today. But the reality is that we are. And much of mindfulness is about the first step of simply accepting whatever emotions are there without trying to fix or change them. That doesn't mean that we're passive, that we don't take action. It just simply means the first step is always accepting and being present with reality as it is. And that's a radical change for many of us. Our minds just don't want to do that. Another reason that autopilot doesn't work is that we all have habitual thinking patterns that we've developed over many years. That's not good or bad, that's just what the mind does. We develop thinking patterns based upon our inherited personality traits. We develop thinking patterns based upon our experiences. And we tend to think in those same ways. We don't plan that, it just happens. Again, that's autopilot. Sometimes that's helpful, but oftentimes we get stuck in ruts, in well-worn thinking ruts. And those really limit our ability to see solutions and to shift perspective. Mindfulness is also about shifting perspective and being able to see things from the point of view of others and from a bigger perspective. I also want to just say a few words about autopilot and happiness and satisfaction with life. Part of what autopilot does is it provides motivation. And again, that's a good thing. We're motivated to accomplish things, to be successful, to get things done, to obtain possessions. And all of this is good, except that the mind is never satisfied. Autopilot is never satisfied. It always wants things to be different. And again, I would invite you to develop your own mindfulness practice and see if this is true for you. I never ask people to take anything that I say on faith, but simply to observe your own mind and see what you find. But most of us will find that autopilot tends not to be satisfied. We get something that we really want, a new car, a new computer, we go on vacation, and sure, we enjoy it for a few days, but then autopilot wants something different, and the thrill is gone, as they say. So I'd invite us to consider that to be truly happy and experience joy and satisfaction in life, we really need to break out of our autopilot thinking patterns, because they get us stuck in wanting things to be different, either wanting something we don't have or wanting rid of something that we already do have. I think Snoopy says it best. One of the things that we discover when we start practicing mindfulness and when we're in the present moment, just experiencing right now, that there isn't suffering. There may be pain, there may be discomfort, but there isn't suffering caused by wanting things to be different than they are. We're just fully present with our lives. When our mind wanders from one thing to the other, we're frequently unsatisfied and unhappy. So now I want to shift to part 2 of this presentation and talk a bit about how mindfulness may be helpful. And particularly with depression, anxiety, and stress. But I also would suggest that practicing mindfulness is a way to lead a happier, more joyful life as well. So how does mindfulness help? Very simply, by helping us break out of the autopilot cycle that we've just discussed. Again, it's not complicated at all. Very simple concept. But it's difficult to do. And that's why we call it a mindfulness practice. It's a continual practice. We never become perfect. And our aim is not to become perfect. We just simply continue to practice. So again, I just want to illustrate the autopilot cycle because I think it's really important to understanding how mindfulness works. So in this cycle, we start out with emotional discomfort in the upper right. And many times when we feel depression or anxiety, we start ruminating about it. We start thinking about the symptom. And that's normal. That's to be expected. That's just what the mind does. It isn't good or bad. And then autopilot often attempts to avoid the discomfort. And one of the problems is that we kind of try to push the discomfort away. And that's where mindfulness is really different. Instead of pushing the discomfort away, we become fully present with it at first. That's always the first step. Because when mindfulness is when autopilot thinking, trying to push the discomfort away, it usually gets worse. Again, the more we think about depression or anxiety, the more we experience it. Oftentimes, then this goes into various stories about the past or the future. And we experience even more emotional discomfort. So that autopilot cycle tends to go around and around. In contrast, mindfulness starts out with acceptance at the top of the cycle. Simply being present with whatever is there in that very moment, not trying to fix or change anything. So in that moment, we're not trying to avoid the emotional discomfort, we're simply being with it. We also find that this leads to less attachment to the stories and thoughts that may be going through our heads. And as I said before, we may still experience the discomfort, but there's much less suffering associated with it because we're not thinking about it and trying to make it go away. The other thing that happens is that when we move out of our thinking ruts, we can see things much more clearly, and we can make good decisions. So mindfulness, in another sense, is all about giving us freedom to make decisions. By breaking out of our thinking ruts, we can see things much more clearly and take action to help ourselves to feel better. But that's based on seeing things clearly, not on autopilot or behavioral patterns that we have used over the years that haven't worked. So, again, how does mindfulness help? Primarily by breaking the autopilot cycle and accepting reality as in the moment so that we're not continuing autopilot thinking patterns that make things worse. And as I said before, it helps us to really see things much more clearly. Instead of seeing things from the view of, I'm depressed again, I don't know how long it's going to last, we see it from the view of, I'm depressed and I can make choices about what I want to do. Another really important concept in mindfulness is becoming less attached to our own thoughts and emotions. And why is that? In mindful awareness, one of the things that we start to do is begin to observe our own thoughts and emotions. And we observe them objectively. My meditation teacher often says, making the subjective objective. In other words, we change our subjective experience of just being in our heads and going along with whatever's happening up there to a state of observing what's happening up there, watching the thoughts come and go. And when we do this, we really notice that thoughts do come and go, emotions come and go. And we start to realize that those thoughts and emotions really don't have a lot of meaning or value much of the time. In some meditation traditions, we call that monkey mind. The mind just chatters away endlessly. And much of what it says doesn't make much sense. Sort of like 150 channels and nothing on. And so in my own personal practice, the more I watch my own mind work, the less I trust it. I really come to see that a lot of what's going on up there isn't making a lot of sense and isn't helpful for me. And I realize my thoughts aren't me. They're just thoughts. They're firing of neurons. And we discover thoughts are just thoughts. That's all. They're not facts. Sometimes they're true or partially true. Sometimes they're not. So one of the ways that a mindfulness practice is really helpful is that by observing our thoughts and emotions, we get some distance from them. Instead of living them out, being carried away with them, it's much more like watching them on TV. And so we discover that we don't have to get carried away with our thoughts and emotions or thinking patterns. And we can see things much more clearly. Another really important concept of mindfulness, which I mentioned before, is this idea of simply being present with uncomfortable thoughts and emotions. And this is really probably the most important concept of mindfulness. In part because we discover that unpleasant thoughts and emotions will simply pass away if we do nothing. If we simply give them permission to be there, even though we have distance from them. And it's much easier to give them permission to be there when we have that distance, as I mentioned before. Thoughts are kind of like unruly children. The more we try to get rid of them, the more they pop up. I like the analogy of the whack-a-mole that you see in the Carnival Midway. You whack it down one place and it pops back up somewhere else. And the more we practice mindfulness, the more we discover that trying to push thoughts and emotions away simply doesn't work. On the other hand, if we start out by acceptance, simply giving them permission to be there and being present with them, many times they just fade away on their own, and there's nothing that we need to do at all. It's a very powerful component of mindfulness. So there's been a lot of research using mindfulness. And I certainly can't go into all of that today, but basically the research has involved two kinds of studies. One is clinical studies, where people are actually enrolled into mindfulness classes and then the outcome is evaluated. And the other is functional imaging studies. And I'm just going to talk a little bit about both. I'm going to mention the functional imaging studies first. And those are studies typically using functional MRI, which you've probably heard of. It's called fMRI. And those kinds of studies actually look at what happens in the brain when a person is engaged in a specific kind of task. And there have been many studies of mindfulness interventions using brain imaging. And there's really clear evidence that mindfulness changes the brain's thinking patterns. And that happens through a process called neuroplasticity. There have also been studies looking at structure, and mindfulness actually can change the gray matter in the brain. And this isn't surprising. The same thing would be true with any skill that you learned. If you start to play tennis, we would be able to see that brain patterns changed because of that learning that skill. But I mention it here because I think it's really important to know that there is evidence that mindfulness does change our brains. In terms of clinical studies, as I mentioned, there have been a number of them, and most of them have involved a couple of different interventions or mindfulness training programs. One is called mindfulness-based stress reduction. It's often known as MBSR. The other is mindfulness-based cognitive therapy, often just called MBCT. And there have been other studies of meditation and mindfulness, but overall, there's quite a bit of clinical evidence that mindfulness does work in a number of general ways. It improves attention, and that's not surprising because mindfulness is really focused on enhancing our attention, as you'll see in a few minutes when I talk about meditation. It also tends to decrease worry and turning things over and over in our heads. We tend to get less emotionally reactive. And very important, we tend to have more compassion for ourselves and others. And this is another key concept of mindfulness, compassion. We find that in mindful awareness, compassion tends to grow and happen naturally. But just part of the mindfulness process is having compassion for ourselves and also for others as well. Other benefits that have been shown in clinical studies: better pain tolerance. And I think pain is a good example of how mindfulness works because we all can relate to it very clearly. If we feel pain in our back, what we do automatically is tighten our back muscles. And again, that's a piece of autopilot. It happens automatically, but those tense muscles make the pain worse. In mindful awareness, we start out by simply accepting the pain, recognizing our muscles are tight and relaxed, and the pain decreases. It may not go away, but again, we have less discomfort from it. By that same mechanism, as we've discussed before, there's a lot of evidence that mindfulness is helpful for depression, anxiety, and managing stress. In regard to depression, there was one study that I want to mention, well actually there were a couple of them, that compared mindfulness-based cognitive therapy to antidepressants. And they found that when someone is recovered from depression and receiving ongoing treatment to prevent it from coming back, we call that maintenance treatment, that mindfulness-based cognitive therapy was equally effective as medication in preventing depression coming back. And I think that's pretty powerful evidence. Now, that doesn't mean people should stop taking their medication, but it just simply means that mindfulness can be a very strong, a very important tool in the recovery toolbox. There's also evidence that it helps for acute depression and as well as anxiety and, as I mentioned, stress management. So the last part of the presentation is really talking about how to get started and what a meditation practice really means. I just want to take a moment to say at this point that, as I mentioned before, we're not recommending that mindfulness replace any other treatment. It's simply another tool in the recovery toolbox. But I think it's a very, very important tool. and bipolar disorder particularly, as many of you know firsthand, can be very difficult to treat. And because of that, having as many recovery tools in the toolbox as possible can be extremely helpful. And that's why I strongly recommend having a mindfulness practice. So meditation is the foundation of a mindfulness practice. Some of you may be very familiar with meditation and others may not. And there are many different meditation techniques out there. But fundamentally, meditation is simply about training our attention and awareness. We simply want our attention to stay where we want it to be. So moving back to autopilot versus mindfulness or mindfulness meditation, in autopilot the mind's wandering. It's going wherever it wants to go and it's carrying us along with it. It's just like being in a fast-moving stream. If we fall in, we're going to get carried away. In mindfulness meditation, we're keeping our attention on the present moment, where we want it, and we're not getting carried away by the stream of our thoughts and emotions. That stream may keep flowing, but we're observing it rather than being carried away with it. And so this is really easy to talk about, but in practice it's difficult because the mind always wants to wander, to go off somewhere else. And so in meditation we typically use some kind of anchor to help us keep our attention on the present moment. And one anchor is our breath. The breath is a great anchor for meditation because it's always there and it's neutral. And one of the meditations that we often practice is simply keeping our attention focused on the breath. Starting out, it's often helpful to count the breaths. Each cycle of an inhalation and exhalation is 1, the next cycle is 2, and so on. Count to 10 and start over. Most of us will find that within a few breaths, a few counts, we have drifted off, and that's okay. We just simply gently escort our attention back to the present moment and start counting again. We can also focus on the physical sensations of the body right now. Again, that's the present moment. Some meditations use a mantra, repeating a short group of words. And movement is a great meditation. We can do walking meditation. Yoga and stretching makes a great meditation. Meditation is simply about keeping our attention focused where we want it to be. It's not anything exotic at all. So mindfulness meditation is just simply being aware of what's happening right now. The physical sensations in our body, the sounds, the sights, the thoughts and emotions that are going by. But rather than being carried away with them, we're simply observing them. The other great thing about being in the present moment is that we notice what's happening. It's the old stop and smell the roses. How many times do we walk by the roses and not even notice them because our mind is somewhere else? How much of our life do we miss because we're simply on autopilot thinking about the past or the future, and we're not noticing the joy or the beauty that exists right now in this very moment. So the goal of a mindfulness practice is very simple. We just want to spend more time being mindful and less time on autopilot. So thinking about starting a mindfulness practice, there are 3 components. Daily scheduled practice, and that means setting aside some time every day to meditate. Most people like to do it either first thing in the morning or last thing at night, but whatever works for each person is fine. Another component then is starting to move mindfulness into our everyday life. How do we do that? By starting to simply do one activity every day mindfully. Maybe eat a meal mindfully. And instead of mind wandering or watching TV or reading a book, we simply focus all of our attention on the meal, on how the food tastes, on how it feels on our tongue, on the movements of the fork or spoon. Being fully present with our meal. It's a totally different experience for most of us than what we typically do. And as we develop a mindfulness practice, we typically find that we spend more and more of our lives being mindful. Certainly not all the time. None of us will ever get to that point. But more and more we notice when we're mindful and when we're not, and making choices to be more mindful. And finally, it's really important to have a short meditation that we can use when we're feeling upset or stressed or just notice when we're on autopilot. And one option is called the 3-minute breathing space. And we're actually going to go through that in a few minutes. So let's talk a little bit about the daily scheduled practice of meditation. As I mentioned before, there are a variety of different ways that one can do this. You can simply do it on your own, or you can use a tape. There are many options available out there in terms of meditation tapes, CDs, MP3s that you can download. The other thing that I would strongly recommend that you consider is finding a group to meditate with. Most towns and cities have some kind of a meditation sitting group. And there's something about sitting with a group that's incredibly powerful. In part, it just helps us do it because if we commit to sitting with a group, we're likely to show up. But also, sitting together with that same intention is very powerful. And it's a great way to develop and deepen our meditation practice. Sitting meditation with focus on the breath is a very good beginning meditation for most of us, and something that many of us continue to do over the years. Other options include the body scan, which is simply focusing attention on different body parts sequentially. Walking meditation, as I mentioned, yoga and stretching exercises. And so I think as you start a meditation practice, it's really, really important to try out different meditations and find out what you feel works well for you. And many of us will find that there are several that we like and do consistently, and some others that maybe don't seem like they fit as well, and we don't use those, and that's perfectly fine. We each need to find our own way. There isn't one meditation that's better than another. I would say the best meditation is simply the one that you want to do. As you start your daily practice, I would recommend practicing consistently at a set time every day if that's possible in your life. Just schedule that time out. You want to be in a comfortable place. It's quiet. As far as the posture, many meditation traditions sit on the floor on cushions. That's not necessary. Many people sit in chairs. That's perfectly fine, and that's a good starting point. But you want to sit upright with a comfortable posture, feet flat on the floor, hands in your lap, in a position that honors your body, eyes open or closed. So sitting in a chair in a quiet room is a great way to start your daily meditation practice. And at the end, I'm going to suggest some resources to help you. Another key component, as I mentioned before, is mindfulness in everyday life. And we can do any task and be mindful. And the more we practice, the more we discover that's true. So I would really invite you, as I said before, to pick one task every day, one activity, and do it mindfully. But just notice throughout your day, are you being mindful or not? And most of the time we discover that we're not being very mindful, and that's perfectly fine. It's just about recognizing that. I want to just go back to meditation for a minute, to the formal sitting meditation, and mention one concept that's really important. Sometimes we tend to think that when we meditate, our mind should be still and quiet. And that's just not what happens. The mind will always tend to wander. And when we notice the mind wandering, we simply pull our attention back to our anchor, typically the breath. And it's important not to be discouraged if the mind wanders, because that's just what the mind will do. It will always wander. And so actually it's very helpful for us when the mind wanders, because then we notice it and get the chance to practice pulling our attention back to the present moment. I like to use the analogy of going to the gym. Each time we lift a weight, each repetition makes us stronger. When we're mindfulness meditation, each time we discover that our mind is wandering and pull it back to the present moment, that's a repetition. That helps us develop that meditation muscle, so to speak. And it's important not to be frustrated about it. The mind just wanders. That's what it does. And so part of mindfulness is just accepting what is with curiosity and with a sense of humor. I laugh at my own mind all the time. It's pretty funny, actually. So now, as we move to the end, I just want to take us through the 3-minute breathing space. And again, this is a meditation to use whenever we feel stressed, anxious, or depressed, because we want to break that autopilot cycle and move into mindful awareness, where we can make good decisions about what we need to do. So we call it the 3-minute breathing space, but we don't time it. It's anywhere from 2 to 5 minutes, maybe even less. It can be more. It can be done discreetly in most situations. We don't have to go on special to do it. And again, we just want to break out of autopilot and into mindful awareness whenever we need to. So there's 3 parts to it. Part 1 is simply taking stock of the current situation. What's going on right now? What am I feeling? What autopilot scripts are running in my mind? What thoughts and emotions have I been experiencing? And once we've done that, then we concentrate our attention and focus on the physical sensations of the breath for about a minute or so. And then after that, we expand and focus attention on all the physical sensations of the body. When we've finished, we're in a state of mindful awareness, and we can make decisions about what we want to do. When we're upset, sometimes we may need to do the 3-minute breathing space over and over. That's perfectly fine. So now, if you will, let's go through the 3-minute breathing space together. So wherever you're at, just take a moment to settle in. Sit in a comfortable position, eyes open or closed, honoring your body. Maybe taking a couple of deep breaths to settle in. And now, let's just do an inventory. Where am I? What am I stressed about, if anything? What's going on in my life? And particularly my emotional state. Happy, sad, depressed, stressed. What autopilot scripts are running in my mind? And now, as best we can, just focusing our attention on the physical sensations of breath. Noticing the sensations of the breath coming in through the nostrils, the chest rising, the belly rising. Noticing the sensations of the exhalations. Chest and belly contracting. Air going back out the nose. And when the mind wanders, as it will, just gently escorting attention back to the physical sensations of the breath. As best we can, keeping our attention on the stations of the breath. Being fully present with each moment. Breath by breath. And now, as best we can, expanding our awareness to include the breath and all the physical sensation of the body. Perhaps noticing the sensations of the body that are typically unconscious, like the pressure of our feet against the floor, clothing against skin, temperature sensations, maybe noticing that the feet are warm, the hands are cool, with an attitude of curiosity and acceptance. Particularly noticing if there are any places in the body that we're carrying our stress. Tight muscles or uncomfortable areas. And just noting that. Simply being aware, fully present in this moment and the next moment. And now, gently transitioning our attention back to the webinar and ending the meditation. So that's the 3-minute breathing space. I would encourage people to practice it 3 times a day and use it whenever you're feeling stressed. So as you get ready to start your practice, I would strongly encourage you to consider a mindfulness or meditation class or using some self-help resources. There are some well-studied meditation trainings, if those are available. As I mentioned, mindfulness-based stress reduction, mindfulness-based cognitive therapy, and mindfulness-based relapse prevention for people with addictive disorders. But there are certainly many other options available out there. There are a number of books available. These are some that I would strongly recommend. The top one by Mark Williams and colleagues. Anything by John Kabat-Zinn, who developed mindfulness-based stress reduction. Full Catastrophe Living is really good by John. And my own book is a guide for people with depression and bipolar disorder. It's not strictly a mindfulness guide, but it does recommend its use. So that concludes my presentation for today. Thank you all very much for being part of it, and I guess we'll take some questions now.
Great. Thank you, Dr. Marchand, for that wonderful presentation. I have the first question. which is I
Okay.
have schizoaffective disorder and have a symptom called playback. And I'm wondering if you can help me with that because it can be a nonstop autopilot, which is awful. And I really want to work, but I'm afraid that I'm going to have a hard time focusing during meetings, etc.
Yes, that's a great question. So I would think that a mindfulness practice could be helpful for you. And the most important thing to recognize is that regardless of whether one has a disorder or not, our minds always tend to wander, and we always tend to be distracted. And that's very normal. And so mindfulness works with that by simply recognizing the distraction and pulling it back, pulling attention back to the present moment. And the most important thing, again, is not to feel frustrated at all if it's difficult, because meditation practice is often difficult, but the more we practice, the more we develop that mindfulness muscle.
Great, thank you. Someone asked, could you please go back to the first book recommendation slide for a moment?
If what?
Could you please go back to the first book recommendation slide for a moment?
Oh, yes. There we go.
Great, thank you. Okay. Waiting for additional questions. Okay, great question. How can we practice this with our children?
Practice if you have children?
Yes, how can this
question?
practice involve our children?
Oh, okay, involve the children in the practice.
Yes.
Another wonderful question. There's been a lot of work in recent years along the idea of starting to teach meditation to children. And of course, it's a little bit different in terms of ability to maintain attention and so on. But the best way is to make it fun, something that kids want to do. Learning by example. If children see their parents sitting and practicing meditation, they'll typically want to imitate it. And so having a short sitting period with children, maybe just 2 or 3 minutes, something that is easily manageable, especially for younger children. And then as they start to get older, they'll be able to spend more time in practice. Some sitting groups have family activities. I think that's really helpful. Oftentimes those may have activities for kids that include short meditations. So I would strongly encourage everyone to involve their entire family if family members are willing.
Great, thank you. The 3-minute breathing space, what was the third part? Someone had missed this.
Sorry, I'm still not hearing well. The first part of the 3-minute breathing space?
Yes, the third aspect of the 3-minute breathing space.
Okay, so just to kind of go back through the 3-minute breathing space, because I think this is really something that people can use. Part 1 is just taking stock of the situation. Where am I? What am I doing? And particularly what thoughts and emotions and what autopilot scripts are playing. Then part 2 is just concentrating the attention and focusing on the physical sensations of the breath. And then to answer your question, part 3 is expanding attention to all the physical sensations of the body. And here we're really just wanting to see what's there with an attitude of curiosity and acceptance, and particularly noticing at that moment if there's a lot of stress that we're carrying around in our body, tight muscles. And then at the end of that, we simply, from a mindful point of view, see what we need to do. And we may not need to do anything, or we may want to take actions to help ourselves feel better.
Great, thank you. The next question, if we're experiencing physical pain, do we focus our attention on those areas when we meditate? Were you able to hear?
No, I'm really sorry about that.
That's okay. Let me repeat. If we're experiencing physical pain, do we focus our attention on those areas when we meditate?
Okay, great question. Physical, and what do we do with that? My answer may vary a little bit depending on stage where you are in your practice. Early on in your practice, it may be most beneficial to mostly keep attention on the sensations of the breath, and when we notice pain or discomfort, being aware of it, but pulling the attention back to the breath. Once we've developed practice a little bit, then it's really important to actually be present with the discomfort. And that's extremely challenging, but it's very, very rewarding. And by being present with it, we simply notice it. We notice if it comes and goes, if it waxes and wanes. We notice exactly what it feels like. And so, yes, as we get into a more advanced practice, we really want to keep some attention on physical discomfort. And begin to really notice that if we stay present in the moment, the discomfort is still there, but the suffering associated with it is not. And I know that may be a difficult concept to kind of believe, and I'm not asking anyone to take it on faith, simply to practice and find out if that's true for you. But everyone that I worked with does find out that that is true.
Excellent, thank you. The next question, can a 9-year-old successfully practice mindfulness given ADD, depression, and anxiety?
I would say the answer is yes. But one of the things about meditation is that a lot of it involves intention and desire. And so I think if there is motivation and intention, then it's certainly possible for anyone to practice meditation. And, you know, it's particularly helpful for anxiety and some evidence for ADHD as well. So I would encourage that.
Great, thank you. Next question. When a serious downturn for one who is depressed or bipolar occurs, how much can really be impacted by personal control or knowledge of practice of mindfulness? Or are you in the grip of an illness where you really don't have much ability to control the onset or minimize the severity or duration of a downturn?
You know, that's a wonderful question. And of course, you know, there's not an absolute answer to that, and it might be different for different people or different for the same person at different times. But almost all of the time when there's a return of symptoms, a relapse of symptoms, a serious downturn, part of what makes that downturn difficult to deal with is the automatic pilot, because it's not only the feelings of the emotion, the feelings of depression, but it's also the thinking about it that increases the suffering, causes it to persist and worsen. And so my experience has been working with people is that even if the symptoms are really intense, mindfulness can make a difference. It may not make the symptoms go away, but it helps the person live with them and move forward with their lives. So one of the things about having a practice, a mindfulness practice, is that if we have an ongoing practice, we can use it when symptoms are severe. And so it's like any other skill. The more we practice it, the more likely we are to be able to implement it when we really need it.
Great, thank you. The next question, is there any kind of meditation that will be helpful when I'm hypomanic? There is little about managing hypomania in psychotherapy and cognitive therapy, unlike depression.
You know, I don't know. There isn't, as you point out, there isn't a lot of studies right now in mania and hypomania. And I still think that a meditation practice may be helpful, particularly because it helps us separate from some of the thinking patterns associated with mania and seeing that, for example, grandiosity is not necessarily real. It's a thinking pattern. Desires for certain kinds of behaviors are just desires. But there isn't a lot of research, and I think there's no harm in utilizing meditation, but we do need more studies in that area.
Great, thank you. I live in an area where depression treatment is still seen as only medication treated. How do I speak with my clinician in order to help them realize how mindfulness truly benefits me over medication without seeming non-compliant?
Well, I would suggest open dialogue. And oftentimes we find that the reality is that for people with bipolar and other disorders, it's really important to take charge of your own treatment. And that's a lot of what I have in my book. And so it may not even be so much convincing someone else as simply developing a practice for yourself. And perhaps others, maybe there's an opportunity to develop a sitting group for people in your area. There may be opportunities there to join in with others and some of those kinds of things.
Great, thank you. Can mindfulness be used to help with specific phobias such as driving on freeways?
With specific phobias?
Yes.
Okay. Yes, it really can. Part of what happens with mindfulness is desensitization. And as many of you may know, one of the really effective psychotherapy treatments for anxiety of any kind is desensitization. And that particularly works for specific phobias. And so in that process, what we find is that by gradually exposing oneself to a situation, the anxiety dies away. And so as we gradually increase the intensity of the exposure, and each time the anxiety dies away, then we can move up to another step. Mindfulness is very, very similar to that because we practice simply being present with the emotion and letting it be and letting it pass on. So, in a sense, a mindfulness practice around anxiety of any kind is very similar to the desensitization of treatments for specific phobias. And I think the way a mindfulness practice can really be helpful, again, is because we start to realize that those emotions feel bad, the anxiety feels bad, but it's just an emotion. The thoughts are just thoughts, and they're not harmful or dangerous. And by simply being present with them and letting them be, they will pass away. And we become very skilled at being able to do that. So I think either in conjunction with another psychotherapy or perhaps even alone, mindfulness could be very helpful for most specific phobias.
Thank you. Do you have a recommendation for an online course for meditation?
Oh, I really don't. There are a lot of courses out there. I haven't done enough research to really feel like I could give a good recommendation for one. So, sorry, I just can't do that.
Thank you. It is time to wrap it up. That was our last question. Dr. Marchand, if you wouldn't mind sharing the next screen of your book recommendations with your book at the bottom of the screen as I wrap it up. I wanted to remind everyone that all of our presentations are recorded and archived on our website. So if there's something that you missed or you want to share, it will be available by the end of the day tomorrow. And I want to thank you again, Dr. Marchand, for talking with us. We greatly appreciate what you've shared with us today.
Thank you. It was my pleasure.